All right, you guys, this lecture is chapter 15. It is drugs for immunization and immunomodulation, and this is out of the same textbook we've been using, the Introduction to Clinical Pharmacology book, version 9. Objectives: explain the differences between innate immunity and acquired immunity. Describe the role of antibodies in providing true immunity. Explain how vaccination affects acquired immunity. List the names, actions, possible side effects, and adverse effects of selective immunosuppressant drugs. Hello. And explain what to teach patients and families about selective immunosuppressant drugs. Here are some words, vocabulary that have to do with the immune system. Vocabulary that you should put into your mindset of nursing knowledge. An antigen is basically a bacteria, a virus, or a foreign invader, a foreign protein that invades the body. It gets into the body somehow. It's not welcome there, it's foreign. An antibody is a special protein made by the body in response to sensing the foreign antigen or the invader. In response to sensing the foreign bacteria. So the body, the white blood cells of the body are like, holy cow, something's in here that shouldn't be in here. Let's make these antibodies so that they can recognize if there are any other of these foreign invaders in the body. An antigen antibody response is a specific antigen causes the body to produce a specific antibody that reacts specifically with that antigen. So the body sees the antigen, and then an antigen antibody response happens, and antibodies are formed and made in the body. And these antibodies go on for a certain amount of time, depending on if it is temporary or if it is a long-lasting antigen antibody response, and detect these cells or these invaders for as long as they can, so that they can notify the body that there's something foreign, something bad, a virus, bacteria inside of it. It recognizes it. The body is able to fight it off better. If you look on page 280, figure 15-2, at the bottom right hand side of that paper, or that page, excuse me, there is a diagram that kind of explains that process as well. You will have to know kind of how that works in order to understand these drugs that we'll be talking about. So I do want you to know what immunity is, but for purposes of this lecture, I kind of want to keep it simple. Page 280 has an overview of immunity. It's basically the body's physical resistance to becoming ill every time you come into contact with something pathogenic, some kind of microorganism, bacteria, anything viral, things like that. It's the immune system working with protective barriers of the body, like intact skin, mucous membranes, different things like that. And the book goes a little bit deeper into innate immunity and acquired immunity, and you can review those chapters. But like I said, to keep it simple, we're going to talk about acquired immunity, and for this slide, naturally acquired active immunity and artificially acquired active immunity. Natural acquired active immunity is a type of immunity that a person develops it develops with regard to a microorganism that invades the body naturally, and it usually makes the person sick, and it triggers an immune system response. The immune system will make antibodies that, remember what I said, when that germ presents itself back in the body, the antibodies see it and they'll start fighting it off before you get super sick. So every time we're re-exposed, like I said, you make more antibodies and you continually self-boost your immunity to it. Artificially acquired active immunity. A person is given a live or weakened or attenuated antigen in a vaccine to stimulate antibody production to prevent specific diseases for an extended period of time, and boosters need to be or can be necessary. If anybody has been on a normal vaccination schedule, you know that we have to get boosters in order to achieve the same amount of immunity that we had when we first got these vaccinations. Flu's a good one. We give a small weakened or attenuated antigen that is going to make the antibodies, kind of wake up and say, hello, there's a germ in the body, and produce more antibodies. And we do that in an effort to try and maybe make you a teensy bit sick or not sick at all, but have your body start producing those antibodies so that they can recognize them, make a ton of antibodies, and ward off any flu that you might see for that season. Remember, boosters are necessary, so that's why we have flu shots every fall, right? Every season it's a little different. The strain might be different, so we have to present it to the body in a different way every year. Other vaccinations that might need boosters are measles, mumps, rubella, the chickenpox vaccination, different things like that. So, talking about active immunity here in the vaccines that we give, um, the slide says inactivated vaccines, live vaccines that are attenuated, and active immunization. Inactivated vaccines are composed of organisms that could potentially cause disease, but they've been killed off or inactivated by heat or chemicals or something like that that prevents them from reproducing and causing disease in the body, with the hope that the antibodies are going to see it in there and produce more antibodies in order to ward off infection. Live vaccines or attenuated vaccines. These are live virus vaccines, and they contain live organisms that may have been weakened. So attenuated is weakened and rendered harmless. So they're not capable of causing disease, but they can produce a little bit of an immune response. So that's something that we can explain if we're giving an attenuated vaccine. Basically weakened to where they cause your body to kind of flare up a little bit, but you're not going to get as sick as you would if you had a full-fledged organism in your body that was causing the same type of issue. Active immunization would be something like a toxoid. So write toxoid next to active immunization on your slides. Those are pathogenic microorganisms that are modified chemically so that they're not toxic anymore and they can be used as a vaccine. Sometimes we use these types of vaccines for pertussis, Hep B, the HPV virus, different things like that. And the bottom here is repetition. As I said earlier, naturally acquired active immunity is any type of immunity you develop to a microorganism when it invades your body naturally. It usually makes you sick. It triggers an immune response. The immune system's making antibodies, different things like that. And then artificially acquired active immunity is the vaccines that I had just explained just a second ago here. One thing I forgot to add on the active immunity slide, the previous one there, is I just want you guys to know the difference between naturally acquired active immunity and artificially acquired active immunity. One you get by naturally coming across a bacteria, antigen, microorganisms, something like that. When I was in kindergarten, I was exposed to chickenpox. I had it for 2 weeks and it was horrible. And then I was immune to it, and I've never had any problem ever since. And I am in my 40s. Artificially acquired is active immunity is just putting in some sort of weakened, killed, attenuated type of pathogen into the body that the body will recognize as a foreign invader and form immunity to it. Now let's go on to passive immunity. Passive immunity, there are two types, naturally acquired passive immunity and artificially acquired passive immunity. And hopefully these pictures that I'm posting will help. sometimes when the body is exposed to things, the antibodies um, are produced by the body, correct? Um, these things are actually called immunoglobulins, and we collect them from humans. We collect them from animal sources, different places, and we use them to give temporary immuno support to people who've been exposed to viruses. So there's two types of passive immunity, and they are natural and artificial. Naturally acquired passive immunity is antibodies that pass from a mother to an infant, could be through breast milk, could be in utero, something like that. And artificially acquired passive immunity are antibodies produced by another animal that are made into a serum. These immunoglobulins are specific types of protein antibodies that are stored in serum and plasma. And we might inject these into a person who doesn't have immunity to an antigen that they're exposed to. So it provides good temporary immunity to make sure that somebody doesn't get too sick. So just remember, passive immunity it's temporary. So your book has a nice little picture that hopefully makes sense. It's on the bottom of page 281, figure 15-3, and these are examples demonstrating the different types of immunity and how they develop. So active is contract of the disease, and you produce memory cells or the antibodies. Active artificial is to receive a vaccination and produce the antibodies, right? Or the memory cells. So we're putting artificially weakened antigens, microorganisms into the body. Passive natural is receiving maternal antibodies through placenta or breast milk, breast milk, or and passive artificial is receiving an anti-serum with antibodies from another host, from another person, from another animal, different things like that. So use this slide to help know the difference. You might have to know these for test taking purposes. And here's more repetition for you. If you didn't know what vaccines or toxoids were yet, here's a little reminder. Attenuated or killed antigens in a formula that produces an antigen antibody response in the body. Toxoids are attenuated or weakened toxins that produce an antitoxin response, causing immunity in the body. You guys can read through these on page 283. All right, let's talk about immunologic medications. What do you guys think the purpose of these medications are? There's a lot of uses for them. We use them for routine administration of immunizations for specific diseases. We have recommended schedules that we go through for children. We have recommended schedules that we go through for people who live in other countries or are traveling. People who are at high risk for complications of pneumonia or pneumococcal infections and high risk for influenza are encouraged to get these immunizations. So if somebody is elderly, is chronically ill or immunosuppressed, healthcare workers, different things like that. We also have other things that we give that we use in screening procedures to identify people who have been exposed to certain diseases, like the PPD shot that you guys, the intradermal injection that you guys received to see if you had been exposed to tuberculosis. The uses for these, like I said, as the slide states, is to produce immunity in the body. So we're producing an antigen or a bacteria or a microorganism, a foreign invader to the body to produce an immunity response, to produce antibodies in the body. Uses, according to the slide, routine schedule of active immunizations, biologic events for endemic disease areas. So I'm talking about cholera, typhoid, yellow fever, special biologic agents for people at high risk, and these are the pneumococcal agents like for the elderly and people who are chronically ill, screening for disease exposure, and we're doing it to modify disease processes in previous unimmunized people. I want you guys to think about side effects and adverse reactions regarding these medications. This slide talks about adverse reactions. So there are mild reactions that are common. There might be some mild local pain, some mild swelling at the site. That could be just a regular side effect, right? Occasional effects include altered levels of consciousness, headache, lethargy, rash, urticaria, um, vesiculation, which are blisters or just rash, itching, diarrhea, increased respiratory rate, arthralgia, which would be pain in the joints, dyspnea is difficulty breathing, fever, um, lymphadenopathy, which would just be swelling of the lymph nodes, and malaise, which is tired, fatigued, just excessively tired type of results. So studying for this type of group of medications, just know these adverse and side effects. If somebody had pain and swelling at an injection site, you might give them some acetaminophen for pain and maybe put a warm compress over the top of the injection site just to take away some of the pain. There are rare instances when these medications are linked to other health problems, but statistically, risk of complications from getting a disease outweighs the risk of adverse effects of the immunization. And that's why we really have to be champions of things like the flu shot and make sure we talk to people, vaccinations, different things like that. There are some other effects that can be treated, like symptomatic type of things. You can advise a person to pre-medicate with something like Benadryl if they're going to get a rash or if they've had a history of a reaction before. Have them pre-medicate with some Tylenol if that's going to help. That also helps with the vesiculation, which is the blisters, and the urticaria, which is the itching and the hives. So for purposes of this lecture, I want you to think about nursing assessment and what you would assess on a patient after you get this type of injection. This slide kind of goes in conjunction with what I just said on the previous slide. We have to assess health history. If they've had immunizations before, what they've had reactions to, if they've had allergies to eggs or feathers. Some vaccines are contraindicated in people with allergies to eggs or feathers because they're prepared with animal syndrome serum, or in chick embryos. We don't give immunizations to people with active infection or if they're severely febrile. So remember, we were talking about over 100.7. We would definitely have to ask the doctor. Any vaccines, virus vaccines we're giving live or attenuated, we would check and make sure there hadn't been any recent history of problems with regard to that. And we would definitely assess for risk for infection, see what they've gotten, what their previous adverse effects have been, allergies, underlying disease process, if they're on any drugs for immunosuppression like corticosteroids. Birth control pills can alter these drugs as well, and just ask lots of questions. This slide just has a list of some recommended vaccines that we give to our patients, and some of these, or hopefully all of these, you've had as well. You guys don't have to memorize this list. You're not going to be tested over that. That's next semester, but I do want you to be familiar with it because you'll see it again. So here's some questions for you. What teaching would the nurse provide to a client receiving a tetanus toxoid? I want you to go specifically off of what we talked about in this chapter. So you will have lifetime immunity from this infection. That's a no. These are temporary, and you will have to have boosters. Soreness at the injection site is a common reaction. We did talk about soreness at the injection site to treat with hot packs or warm compresses, I guess, and Tylenol for pain. This medication must be repeated weekly for 4 weeks. that is nothing that we talked about on here, and this is a one-time toxoid until it's due for a booster. Increased fluid and fiber in your diet to prevent constipation is not a side effect of this drug either. So simply soreness at the injection site is a common reaction is the answer. What is the priority nursing assessment to monitor when administering vaccinations? Myalgias, which are muscle aches. Priority is the key here, right? Priority nursing assessment. Anaphylaxis, would that be a priority? Remember I told you that anaphylaxis is an emergency and people can die from that. So that is a good priority, something to assess with regard to throat closing, swelling, people having difficulty breathing. Symptoms of infection is definitely something that you should um, assess for, and pain at injection site is not a priority. Here are the references. If you have any questions, let me know.